CDC is out with an urgent public health warning this morning about a deadly fungal infection that is spreading across the U.S. rapidly. Health officials say Candida auris is a resistant infection. Several antifungal medications it is resistant to, and it's primarily a threat to people with weakened immune systems. The first infection was reported in 2016. The most recent numbers show cases have spiked to nearly 2,400. Candida auris has been detected in more than half of the United States, and according to the CDC, it can spread from person to person or from touching a contaminated surface. It is estimated more than half of all people who become sick with the drug-resistant fungus die. It's a big concern. All right, here to talk more about it this morning, public health physician Dr. Chris Parnell, at Regent at Large for the American College of Preventive Medicine. Doctor, great to see you back again. So this fungus, this drug-resistant fungus, starts to have some similarities in a very popular TV show right now that people have been watching, The Last of Us. So I guess it seems like a very scary possibility if you've seen that show. Are we in danger of some zombie fungal apocalypse? What's happening here?
Hi, Marni. I think the most important thing for people to understand is that, one, this fungal infection right now is most at risk for those who are in healthcare facilities. So we're talking about people who are in long-term care facilities or people who are hospitalized in intensive care units. Typically, this infection does not wreak havoc in a healthy person's body, but in someone who has a poor health or weakened immune state, especially someone who has invasive medical devices in their body, that person would be at risk to have a very severe infection and unfortunately death. What we do know about Candida auris is that it is multi-drug resistant, and that's what's really concerning for those specific populations in those settings that I just described.
How common are these fungi in, our life day to day? I mean, is something like this likely to happen again that's going to impact people who are not immunocompromised? Is there a larger concern here to understand how these things work and spread?
We don't have any cause for concern that the general public right now should be alarmed. You come across fungi, you come across parasites, you come across bacteria in the natural environment and across your activities of daily living. But in those persons in healthcare facilities, now I do think it is important for people to recognize that we have seen a rise in multi-drug resistant parasites, fungi, and bacteria in healthcare facilities across the pandemic. And that is a cause for concern. And this is why the CDC is tracking that closely. So for the general public, this is just information to know about. And if you happen to be visiting someone, an elderly person in a long-term care facility, or visiting someone in a hospital that's in an intensive care unit, those precautions need to be taken so that this particular bug, which can endure on surfaces and can be transferred person to person, doesn't lead to an adverse outcome in someone who is already very, very sick.
Okay, good information to know there. This drug shortage situation is of major concern, particularly because it does involve some cancer drugs, as I just mentioned. Talk a little bit more about why we're seeing this and how hospitals are then responding to treat patients.
Definitely. There are a host of issues that we think are contributing to this 10-year decline in these drug shortages. I think it's important for people to know it's a type of drugs that there is less access to. As you mentioned previously, these are drugs that are commonly used to treat various types of cancers, but also we're seeing drugs that are used to treat respiratory illnesses. For instance, albuterol, which is an inhalant. It's used to treat common respiratory illnesses. So what the concern is what are those manufacturing problems or snafus? What are those quality control problems? Are these businesses not adequately equipped to meet the evolving and increasing demand? So we have to look at that supply chain and interrogate it more fully to ensure that medications such as those that I just mentioned can be at the ready for physicians in healthcare facilities to treat those patients who are most in need. Otherwise, we have our pharmacists having to do compounding and repackaging of medications to ensure that appropriate doses are still getting to the people who need them most.
Important information. As always, Dr. Chris Parnell, thank you.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.